actually specialized medical care for anybody with a serious illness. It's a subspecialty of internal medicine and other medical specialties throughout the United States. And the care is really focused on providing patients with relief from physical symptoms such as pain or another symptom, and the stress that goes along with living with a serious illness. And the treatment is geared towards both patients and families. We understand that while the patient is the person who is directly suffering from liver disease or cancer, the family member is also going through that process with their loved one and may also need extra support or have questions about what's going on with their family member's health. Palliative care is provided by a team of specialists. This includes doctors, nurse practitioners, nurses, and social workers. And we often have complementary therapists that go along with that. So at Sinai we have art therapy, massage therapy, and child life specialists for patients who may have children who don't really know how to cope with their parents' illness, or parents who don't know what to say to their children about what's going on with their health. Palliative care is really provided at any age for any stage of disease. So what I want you to understand is that it can be provided along with curative treatment. This is the kind of treatment that complements everything else that a patient is getting, but really allows us to focus solely on how someone may be suffering, and our sole job is really to alleviate that suffering. So this is a spectrum of care, and what you see here is curative care over here on the left and palliative care. And you can see that as people progress over time, there's a mixture of palliative care and curative care being provided together. And this mixture will change over time. Some people may be out of the hospital at home and doing fairly well, and the focus is primarily on curative care. Then they may have a sudden illness and get hospitalized, and during that time there may be a focus on symptom management and getting their symptoms under control so they can get back at home. And at the end of this spectrum is hospice, which comes in prior to death. And for some patients, they will never enroll in hospice, and they'll get palliative care along with curative care, for example, while they're waiting for a transplant. And other patients who may no longer be listed for transplant or may no longer want to be listed for transplant for whatever reason, may transition to hospice as a way of providing additional support for them, both the patient and their family, ideally at home or in another care setting where the patient wants to be. So in terms of palliative care for liver disease, some of the focus may be on treating symptoms such as pain, shortness of breath, feeling very tired or fatigued. Itching can be a significant problem for people with liver disease, depression or anxiety. And then there's also a large component of this that really focuses on emotional support, spiritual support, and support for coping throughout the continuum of this illness. Providing that support to somebody as they are excited about being listed for transplant, or scared about being listed for transplant, or disappointed when they're no longer listed for transplant. It's our job to really provide that extra layer of support. And if you want to learn more about palliative care, this is a fantastic website that provides information geared towards patients and family members or anybody in the lay public on how you can get palliative care and what the options are.